So before we play a role, because today we'll be handling OET speaking, to be honest, the speaking criteria is the same for all professions, whether you are a nurse, a doctor, a pharmacist, or a physiotherapist. The speaking criteria, the scoring criteria remain the same. Today, we'll just run through quickly and then try to do some like have role play practices then before we go over to reading. Rosie, can you hear us?
Yes, I can. Good
Yeah, your
afternoon.
pharmacy, yeah?
Yes, please.
That's fine. So I'm glad you came in now because I want to make a general this thing on that speaking. We want to start with speaking first before um the next phase. Okay. Hello?
Yeah, I can hear you.
Yeah, is that okay with you?
Yes, please. Yes.
That's fine. So for the speaking, the scoring criteria is generally divided into two. You should It generally divided into two. The first is the linguistic criteria, and the second is the linguistic criteria, and then the second is the clinical communication criteria. But the fact is, most candidates they can speak English, especially those of us from Nigeria. So our English is quite good. So you don't have most of the time you will not have issue with linguistic criteria. And the fact still remain that even with linguistic criteria, if you fail the linguistic criteria and you're able to get the clinical communication criteria, you are more likely to pass than someone that has the linguistic criteria but failed the clinical communication criteria. So, in a nutshell, you stand a chance to pass that exam if your clinical communication skill is quite good. That's why even people from a very poor speaking background, they can pass OET, score over 400 when they are very good to express this communication criteria. So we look at both, although they all have same marking um, score, but the chances of you passing is higher when your clinical communication is good. So the linguistic criteria is just looking at how your intelligibility, your pronunciations, are they clear? When you speak, do you speak clearly with correct stress and intonation? Which sometimes to most of us it might be quite difficult, but no one is expecting you to change your accent. So it's just that stress. Like everybody knows that I have this Igbotic, very strong Igbotic accent, which I'm very proud of anyway. Most person will
Exactly.
be like, but your name is Tunde. How do you have this accent? You see? Yeah, I was born and bred in the East. So that's why I have a very strong Igbotic accent. And I'm actually very proud of it. So I can't change it because I want to speak OET English. And that will not affect your score. We all do. Some people have this strong Hausa accents, some have strong Yoruba accents, some have that strong Bini accents and all. But try as much as possible to pronounce your words, to make your pronunciation very clear. And whatever you are saying is, if it is very easy to understand, it makes that's what is needed. So don't try to fake your accent at all because that will mark you down. Then your fluency, try to flow naturally. Don't hesitate. In English language, it's entirely okay for one to occasionally hesitate, like say something like, that's good. But when it's too frequent, it impacts negatively on your score. So there should be minimal hesitation. And appropriateness of language is another thing. If you look at all this OET speaking, you will realize that in the speaking, what's your interlocutor most of the time is the patient. Why you are now the candidate, either a doctor, a nurse, or a pharmacist, as the case may be. So whatever the criteria, whatever the role is, the object remains the same, which is the interlocutor now, the patient. Now, you should use layman-friendly language. It's not a time that you'll be saying, oh, your father had a myocardial infarction. A layman will not understand what you're talking about. So you should use clear terms that everybody can know. You can say your father had a heart attack. So everybody knows what heart attack is. So try as much as possible to avoid medical jargon and be professional and polite in your tone. Don't be rude. Grammar and expression. So you should use accurate grammar. Your range of sentences should be correct, and your sentences should have clear meaning. So when we talk, we kind of pause, just as what I'm doing. So we just don't talk as straight. Like, let me give an example. Let me say, when we talk, we have to talk. We don't just talk as straight. You just keep saying without breathing. So try as much as possible to breathe. Yeah, you talk, you give time for someone to respond. It should be like a communication and not you giving a speech. The clinical criteria assess how well you communicate as a healthcare professional, because that's where a lot of other things that we don't look at in general speaking start coming in. First is your relationship with these patients. When you start the whole scenario, how was your greeting? Was your greeting warm? Was it lovely? In your relationship or speaking with this patient, did you express any empathy? Were you respectful to this patient? They also look at you looking at the patient's perspective. When patient is concerned or worried, how how um how are you able to pick up these cues and respond to them? Are you an active listener? Does your patient say one thing and your response is another thing altogether? Your emotions, when patients are angry, do you validate their emotions? These are very important things you have to look at for in that speaking. And then the structure is already provided for you in all your in all your cards. They will provide the structure you have to follow. They tabulate things for you. So try to follow that structure. Don't mix things around. But while following it, try as much as possible to also listen to the patient and see what the patient is asking instead of you getting fixated on your cool card. And then information gathering, that's where some students, they really don't do very much well on, because these cues, these things have been given to them to say, they forget they also have to gather information. Yeah, even when it is not asked there, try to ask patients some questions, and by so that you check those boxes and gather your score there. Don't use interrogative method as if you are a police questioning a criminal. And your information giving, how do you give this information? Do you give it in clear explanation to this patient? Let's say you want to give inpatient information on how to stop smoking, stop alcohol drinking, and take medication clearly. Do you just give all this information at once, or do you give them in chunk? You are expected to give them in chunk and allow the patient to respond than you just giving everything at once. So when you give everything at once, the patient might forget the very first thing that you said and just respond to the only last thing that you've said. So you should try as much as possible, give the information in chunk, and try to also check their understanding. When you've given this information, do they actually understand what you are trying to the message you are trying to pass across? And remember, when you are making a decision, prescribing a treatment for patients, this should be a shared decision. When you say something that I'll be prescribing this for you, don't just leave it that way. You should be able to ask the patient, just like I asked Rosie just now, is this okay with you? Do you get still ask, do you think that this is what we can do together? Do you think that you are open to take these medications as prescribed? The patient might say, oh, no, I don't want this. I want it to be once in a. You cannot say, okay, we can do you understand? So it should be shared decision making. The patient should be involved in your negotiation plan. Okay. So in all that I've said, the key things you are supposed to take out from here is that number one, you should use simple English. Don't try to start bringing vocabulary. Nobody is concerned about that vocabulary. The more sophisticated vocabulary you use, the higher the chances that you are likely to fail that exam. Because in that case, you are causing these patients most problem to understand what you are saying to start with. So you just use simple English. Okay. But empathy is the central key. You have to always express empathy when you are having communication with this patient, and your communication should be structured. If you do all this very well, you are more likely to pass that exam. So we'll be having a practical approach now. So I don't know who is ready to. We use one person using all these criteria to assess. I don't know who will want to go first. I'm glad we have a doctor, a nurse, and a pharmacist. So I know you guys have not. I don't know. Has any of you tried having practicing at all with anyone?
No,
Yes.
not yet. For me, no.
Olayinka said no. Ebere, what about you?
Yes. I'm
Okay,
practicing with
good.
someone, the colleague.
Rosie, what about you? Have you tried practicing with someone? Hello, Rosie, your mic is muted.
Sorry, my background is noisy, but I can hear.
Okay, that's fine. Have you tried to? Okay, that's okay. Who want to go first? I think it will make sense for Ebere to go first. Now that you've been practicing, at least let's see if you've been doing the right
But
thing.
our practice, nobody is correcting us. We are just practicing.
That's what we want to do now to correct your mistakes.
Okay.
Can we
No
give
problem.
you? Can you be the first person to go?
No problem.
All right, that's
We
fine.
are here to learn.
Okay, so I don't know which will do. Now, on the exam day, you are going to have a task like this. We'll start with the you now. We are going to have a task like this on that exam day. Now, this is the cool card that you've been given on that exam day. You will not see the interlocutor, what the interlocutor is holding. The interlocutor will be holding something like that too. Yeah, but the interlocutor's task now will be for the patient. Now, on the exam day, note you have two role play cards to play that very day. Both of them is still the same format, still the same scoring. They do all that just to be very sure you can speak, you can communicate. But it might be different topics. Maybe one might be talking about diabetes, another one might be talking about hypertension, but it's still the same format. You will have 5 minutes to play that role play card. But before you start the role play card, they will give you 2 minutes to go through this case note, through the cool cards. But before the exam even starts on its own for the speaking, there is what we call warm-up session that will last for a couple of minutes. I think about 2 or 5 minutes, not very clear now. In that warm-up session, it's just for the interlocutor to warm you up. The interlocutor will be asking, oh, how are you? How did you travel to this place? Well, which school did you finish? Why did you decide to go into pharmacy? Why what's so special about reading pharmacy? What's so special? So these are the kind of questions they are asking just to make you relax, because definitely this is an exam. You will be tensed as normal. Do you understand? But when you know what you are doing, your tension will be far much reduced that somebody that was not just prepared at all for that exam. If you are well prepared, definitely you will still have a little bit of anxiety, but at the same time, it will not be much. What they now do is to try as much as possible to start by trying to calm you down with all those questions. Note, those questions are not, they are not marked. Whether you lie there, you say the correct thing, nobody cares about it. So it's not, they don't mark those questions. But what I want to let you know is this. If you have problem with speaking, for example, those that stammer, yeah, don't try to hide your stammering at that point, because that's what they are going to still use to weigh whether you are now pretending now that the exam is now on, and that's now when you start to stammer. So if you stammer during that period, make it very obvious that you stammer. If you even over exaggerated at that point, it's even better. Make it very obvious that you stammer at that point, okay? And so that that will also be considered when they are marking your main, when the exam now starts. And during that communication period, if at that point you start to do supre, start forming accents, all of a sudden the whole communication now started. You now revert back to your baseline.
Normal thing.
Your own on just be natural as possible. Use your normal accent. Speak clearly. Okay? Just use the accent that you're comfortable with and speak clearly. Just like me now, I'm talking, you can hear me clearly. This is where I speak, no matter where I find myself, whether I'm working in the where that I'm working in the UK, this way I speak. You get what I mean? So I believe my destiny is very clear. So these are the points. Just to summarize, when you come into that exam that very day, on the speaking day, there will be a warm-up exercise first, you and the interlocutor. The interlocutor will act as a patient. When that is over, the interlocutor would have told you his or her name. You can ask that interlocutor when the task starts, is that the name you want me to be calling you? You might say yes, he might say no. Even when the task starts again, you can decide to ask, to pretend as if you don't know the interlocutor's name and ask what his name is at this point. Do you get? And whatever name the interlocutor tells you, please use that name. If the interlocutor say, I am Amy, please use Amy. Don't start adding Mrs. Amy, because I know we Nigerians, we try as much as possible to be respectful. Don't try to add Mrs. Amy. But if the interlocutor has said, call me Mr. Anderson, please maintain that Mr. Anderson for the interlocutor. But let's assume you've forgotten the interlocutor's name. You can't even remember, and you don't want to react at that point. You can give the interlocutor a name and maintain that name. But that's not the best thing to do. The best thing to do is to ask the person's name and then try to, but I will show you how you go about this now, okay? So after that warm-up exercise, the stuff starts, you do the first 5 minutes, that ends, they give you another cool card again, give you another 2 minutes to go through it, and then another 5 minutes. When that is done, your exam is over. Whether you score 500 over 500 is dependent on those two cool cards that will determine if you know how to speak English or not. Is that not funny? That we speak English all our whole life and we still have to be writing all this exam. All right, that's fine. So let's get started. Now, this cool card has been given to you, Ebere. You have 2 minutes to go through it, and then I'll ask you to start. Your 2 minutes starts now. All right, please start.
Hello, good morning. Hello, good morning, Mr. Thompson. This is
Good morning.
Laurencia. Please, Mr. Thompson, what happened to you? May I know what really happened?
Okay, don't know, to be honest. I'm just experiencing this dizziness for like 5 days now. And as I was trying to get up from the bed, I felt a bit drowsy again and landed on the floor. To be honest, I can't really remember clearly what's really happened. But do you know what's going on with me?
Oh, Mr. Thompson, I'm so sorry for what really happened. I would like you to know that I cannot actually say what is really wrong with you, but I would suggest that we should carry out some investigations like a CT scan of the brain. With this result, we will know if there is any damage or any fracture on the brain or if there is any internal bleeding. I don't know if you would like me to carry out this CT scan so that we know if we are to refer you to another hospital for admission or we find out if we are to continue with your management in this setting. Do you agree with me?
To be honest, do you think what is happening is life-threatening? Why all the CT scan?
I understand your feelings and your fear. The CT scan is not really that it's threatening, but from the CT scan, we'll be able to find out the extent of the damage in your brain. So I think it's very important to carry out the scan. I don't know if you agree with me. Can we go ahead and do it?
Okay, that's fine, but I don't know. You talked about if anything happened, I will be admitted, but I'm really not happy to be admitted in the hospital because I don't want to leave my cat alone at home.
Oh, Mr. Thompson, I understand your feeling and your pains of leaving your cattle at home. I want to reassure you that we will find someone, I will make an arrangement concerning your cattle who will be able to handle it and take care of it while you are on admission. Will you be fine with that?
Okay, but I don't know. But how long am I going to stay in the hospital, if I may ask?
Thank you for asking me that question, Mr. Thompson. I really understand your feelings. For now, I cannot say how long we are going to stay. I can't really say. It depends on the results of your CT scan, and it depends on how it's the doctors that will decide, actually. I'm not the one to decide, but I promise you that what we want is just for you to get fully treated so that at the end of everything, even if you stay more than 1 week or 2 weeks in the hospital, what we know that is for you to be fully treated and get your senses recovered. Are you okay with that?
I see. Okay, I think it's up to the doctors then, from what you've just said.
Yes, yes. And I will advise you that please, if at all you'll be admitted, just comply with everything that the doctors will say to you. Do you, under, do you understand? Hi, God.
All right, that's fine then.
I still have time. Mr. Thompson, do you have any question or any clarification that you want me to talk on?
No, not at all. I think you've been very helpful, to be honest. I like the fact you are making arrangements for my cat.
Okay, thank you for that. Please, if you have I think I still have more time. I don't know to say again for that bit. Oh, I don't know what to say again.
We'll address that. I'm just waiting for your time to be up. All right, your time
Okay.
is up now. Okay, that's fine. To be honest, that's actually a fair attempt. Can we hear what others think about this speaking? Olayinka, what do you think?
Like you said, it's a
I
fair
know we are all
attempt.
learning at this point. Even if you speak, if you make your own now, you might make a lot of mistakes, but that doesn't prevent you from correcting anyone. So just say what you think you noticed.
Well, she tried because she was able to talk on all the points, all the tasks given, and to me, it's really fair because she made attempts in everything. The only thing I just noticed is
All
maybe
right.
at the
Hold
beginning
on.
of the
Hold on
conversation.
this thing. I'll be correcting whatever thing you are saying first. You said he tried because he was unable to talk on all the points. Remember, there is no mark for you talking on all the points.
Okay.
So it
All
should be
right
based,
then.
your score is based on your marking criteria, not whether you finish your task or didn't finish your task at all. All right, go on.
Uh, okay. Another thing I just noticed, maybe at the beginning of the speaking, I didn't. She just started going straight to the task without maybe introducing herself to to the patient.
Very
And
good. Very good. So in that case now, what happens to this that place now, the mark on this side now will definitely be dropped.
I thought I said, hello, Mr. Thompson. I'm Nurse Laurencia.
You
no, you
did
didn't
that,
say
but
that.
it wasn't like a warm, they say like a warm greeting.
Okay.
Do you
Okay.
understand? You just rushed over everything. The patient did not even
Okay.
talk, and you just went straight again into the point. So it was just too, it wasn't like a warm greeting. There should be like a warm greeting at that point. Do you understand? You greet
Yes.
somebody, hello. So at the part is to expect the person to respond. Yeah? Not just hello, blah, blah,
Okay.
blah, 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 blah. Do you understand? Hello, hello. I'm Tunde, one of the doctors in this. And again, let's go back to your task. Your
Mhm.
task, oh, sorry, not this. Let's go back to your task. The setting is in nursing home. Do you understand? Hello,
Yes.
hello. I'm Tunde, one of the nurses in this nursing home. You get? May I know your name, please? I do understand that you already know this. You already know this patient's name. In that case, you can say something like this. Hello, Mr. Thompson. The person will now respond. Hello. You now introduce yourself. I'm Mr. Thompson, one of the let me say I'm the nurse now. I'm referring to myself now. I'm today one of the nurses in this nursing home. How are you today? Do you understand?
Okay.
You can start that way, or well, the person now responds, hello, hello, I'm this one of the nurses introducing me. I do understand that you had a fall. Can you tell me what has happened? Do you get? But there should be a little bit of that, even if it's just one way, two-way communication at that initial point before you start your task.
Okay.
Okay?
Yeah.
Yeah, go on, Olayinka. What else do you notice?
Well, the key one that I was able to notice, then maybe part of the discussion, although when you are discussing, you are nervous or the exam hormone is
Yes.
on,
Yeah.
that kind of stuff.
I'm sure.
Because at the second point here, when she was talking about the investigation, like in the write-up here, they were had that the patient fell, is not able to understand anything and stuff. Maybe the breakdown of the brain CT scan and possible using a layman to the understanding of the patients will have been more helpful.
Yeah.
Maybe, I'm just thinking.
Yeah. So
To
how will
the
you break it down for this patient?
Well, for this patient, before using the word CT scan, I might probably, okay, I would like to do further findings in order to know exactly what is wrong with you, like, like having
Mm.
photograph of your brain. This we call CT
Yes.
scan, you know.
Yes. Yes. So we may need to scan your brain or have photograph of your brain, which we call CT scan. Yeah. Just to be sure that you've not bled in your brain. Yep. That's a very good this thing that you highlighted. That's a good one. Any other thing that you noticed?
Well, then I think to me, if I don't like the last part, maybe I've finished my time and stuff. I still have more time, then I can talk about, like a reassurance to the
Good.
investigations, to the treatment, just to
Good.
allay the patient's fear and more willing to be committed.
Again, that's an approach that you can use. It's totally and absolutely acceptable for you to end your tax. There is what we call the resolution. Do you understand? You can actually have a resolution then and end and do you get? But we'll come back to that again. Rosie, you said where you are is a bit noisy. Are you able to speak or talk at all, or should we just move on? Hello, Rosie.
Yeah, the background is noisy, but I'm listening. So I don't know, like,
Do you have anything to chip in? Because we can actually hear you and we are not disturbed by the background.
no, Lainke has said it all, like,
Okay,
almost the same thing.
that you wanted to say. Okay, that's fine. All
I
right,
have a
so,
question. I have a question.
okay,
My question is, okay, like this one, they said you are looking after a 70 something. So in this case, this is my patient, right?
yes.
Okay. Do I
You are
need
in a nursing home. You are in a nursing home. This is your
uh-huh.
patient. Do you get?
Okay.
Yeah,
Okay.
it's your patient. You're in the hospital. You will still need to like introduce yourself to the patient.
Okay.
Do
So
you
do I
get?
need to ask for the patient's name?
You can say, can you confirm your name for me? Because this is your patient, but you want to see if you are with the right patient. So you asking, can you confirm your name for me is still okay.
Okay. Oh.
Yeah. So that's fine. But let's see, you did, there are a lot of lovely things that you did, to be honest. Number one is that your fluency was very good. Your sentences were very clear. Your grammar, everything you did, your linguistic criteria is quite top notch. Yeah. You were able to pause. Your sentences yeah, kind of going on and like getting things in chalk, although you occasionally overgive information anyway. But overall, you did quite well in terms of the linguistic part. Yeah, apart from the little corrections that we make, you should make your this because you're talking to a layman, make the brain CT scan for the person to understand what you mean by that. Then in terms of your relationship building, you tried, you were always calling Mr. Thompson, because that helped to foster your relationship building when you keep calling the patient his or her name when you are talking with the patient. Do you understand? That's actually very nice. And again, in the empathy, putting yourself in the patient perspective, you also tried. Sometimes you kind of, oh, I understand how you are feeling and how this, but you kept repeating that same phrase over and over. There are 1001 things that you can actually say, not necessarily how I understand how you feel. Okay, that's what you just have to take note of. And then in your, to be honest, your information gathering was not really very good. Apart from that first open question that you kind of immediately throw to the patient and just move on, your information gathering was not very good. And I always advise, while gathering your information, try as much as possible to do it that early enough. Yeah, what happened, and the person told you, and from that background information, you can pick one or two things there. He said he's feeling dizzy, woke up this morning. Do you get? You can ask, did you bang your head anywhere? Do you get? Oh, he said, I cannot remember clearly if I banged my head or not. You can just ask one or two questions. Any bleeding anywhere from your head? He said no. Okay, then you move on to the next. So you've checked, you've always kind of checkmate on that one, tick those boxes, and then you move on. So in that your information gathering, with that, I think you can definitely get your full mark on
Right.
that one. Okay.
Okay.
Yeah, but overall, I think you did well. We have less than 1 minute for this session to be over. When we come back, I will explain to you how you express empathy from the beginning of this task to the end before we go to the next task.
Okay.
Is that okay?
Yeah, thank you.
Okay. It will take us another 10 minutes to research. So if this session ends, we take a 10 minutes break and come back again.
Okay.
All right.
Okay, so what I'm going to do now, I'm now going to play the reverse role. I'll be playing the nursing role while you play the interlocutor now. And then from there, so I still have 5 minutes to do that. And when it is 5 minutes, if I don't stop myself, you guys should stop me then. All right, that's fine. So let's get started. So I've already read the case note and all. So the task now we want to start. I can start this way. Hello, Angela.
Hello.
Yeah, I'm Tunde, one of the nurses in this nursing home. I've come to check up on you. How are you doing today?
I have been experiencing some kind of dizziness since 5 days ago, and this morning I've been having some kind of drowsy, and I don't know how suddenly I saw myself on the floor this morning, and I can't remember anything at all.
Hmm. So sorry to hear that. That must have been quite frustrating for you. But from what you just said, you said for the past 5 days you've been having dizziness, and this morning you don't know what's happened and you find yourself on the floor. Did you hit your head anywhere?
Not at all.
Okay. And at the moment, are you in any pains?
Yeah, I'm experiencing like a frontal headache since the incident. Oh, this place is paining me seriously.
Okay. So sorry to hear that. But from what you've told me now, I'm really very much concerned about the headache you are feeling and finding yourself on the floor. Perhaps you may have hit your head somewhere of which we are not sure. I will give you some pain medication to help you with the pain if that's okay. All right. Then I'm going to request an investigation to scan your brain. We call it CT scan, and this will help us to know if there is any bleeding in your brain. Are you happy for us to do that for you?
Of course, I'm happy if you can. I'll be glad.
Okay, that's fine. So we'll organize that, Jane. But from what we've said so far, um just to still reassure you that if this scan is done and we find any bleeding or any blood in your brain, we might need to admit you in the hospital. Do you think it's what you are open for if that happens?
Don't please. I don't think the admission is necessary because I have my dogs at home. I'm worried. I don't know. I don't have anybody to take care of them. I don't know if I can accept the admission plan, please.
I see. Oh, Jane, it's quite touchy. You are so much concerned about your cat, which is quite lovely, to be honest. But let me reassure you that we do have services where we can actually make an arrangement where your cat can be taken care of while you are in the hospital. I can assure you the cat will be properly taken care of. If that arrangement is made, do you think you'll be open for us to get you admitted in case we find any bleeding in your CT scan?
Of course, if the arrangement will be carried out, I will accept the admission because leaving my cat behind without anybody attending to them, I will not be happy with that. But since you say so, there is no problem. You can carry on. You can carry on with the
Oh,
admission.
that sounds quite lovely, Jane. Jane, at this point, do you have any other concerns apart from the cat that you are worried about?
I'm worried. Please, may I know how long will I stay in the hospital if at all I'm being admitted, please?
Oh, okay. I'm glad you asked that question, and I do understand you may be concerned, but to be honest, I'm the nurse in this nursing home, and the admission will be in the hospital where you have the doctors who will be taking care of you. I suppose they are going to work out how long that's going to take because I'm not very particularly sure. But if I get more information, I will let you know about that. Is that okay with you, Jane?
It's okay. Please, I really want to know how long it will take so that I will know how to plan myself. Thank you.
Sure, I do understand. I'm really so sorry this has happened to you. We quickly make that an arrangement, get a CT scan done, and then do take care of you. I'll also offer you some pain medication. I will see you shortly, Jane. Do have a lovely day.
All right. Thank you.
Bye. All right, that's
Bye.
fine. So this just a bit of this speaking. To be honest, I can't actually remember the name I gave you initially, whether if it was Jane, but I kind of maintain that
Miss-
Jane Archer. So, but in reality, the fact is you just have to build that relationship and maintain it all through. You have to give the patient time to speak. You have to praise the patient, find a way to praise the patient because they tick all those boxes. Like when I praise you for even asking that question, these are the type of things that they look at from. You see, some of the cues that I you meet incorporating myself in the patient perspective. It's not just only saying sorry, this. I actually
Mm,
decide to offer this patient some pain medication. Do you understand? That's also show I'm
okay.
incorporating myself in the patient perspective. Do you get? So you try
Mm,
as much as possible to be kind to your patient to show that you are concerned about this patient. Just look at it as if you are in a real life hospital setting. Do you get? Or
mm,
nursing home or in a pharmacy setting, wherever it is. The way that you treat this patient, the way that you usually treat a patient, that's what you are also expected to show forth, to showcase in that speaking environment. But it should center around what you be given in the task.
mm.
Oh,
Okay. You
yeah.
have said it. Okay. You have said it all. But my
Mm.
question is, okay. For this, you said you will offer me pain medication. As it's not stated here, it's right to say it.
Yes, it's a bit of showing
But
empathy
it's
to
not
the
part of my
patient.
task.
Yeah, it's a
Okay.
bit of showing empathy to the patient. Yeah, I even ask you if you are in pain. It's not in this case note, but I have to ask you. It's also a bit of me showing that I'm concerned about you and also using it to gather gather information about what has happened.
Okay.
Do you get? So somebody has
Mm,
fallen, he found himself in the floor. It's an old lady. Do you get? And you see, he has been
mm,
feeling dizzy. You show some compassion. So these are little things that you can do. So all this build up to build up those marks on the clinical criteria.
okay. Thank you.
Yep. Does anyone have, do you have any other thing to add or chip in from any question from the class?
No, no question.
Okay, Tobe, do you have anything to add?
Yeah, I have something to add, sir.
Okay.
I think what the major thing that I got from your speaking is the empathy.
Yeah,
And I've also noticed that rushing to finish the speaking task is not what gives you high scores.
at all.
Yes, you have to chunk and check. That's the word.
Yes.
So you check with the patient. Is there any question? Are you okay? Are you happy for us to proceed? Is there any other thing you feel you want to talk about? Can you explain back to me what I've explained to you? Are you confused? Okay, then you now go to the next. So that's what you did excellently. And I think it was a very wonderful answer. Thank you.
Thank you very much. So that's just a summary of what is expected of you. I like that's the statement I was looking for, chunk and check. Do you understand? So your goal is not to finish the task. Your goal is try as much as possible to make this communication as real as possible. There should be bi-directional flow of information. Most of the information should not be coming from you. If a patient is talking too much, you don't even need to cut the patient short. Allow the patient to vent and say whatever you want to say, then respond accordingly. That's what the OET speaking is all about. And when you do it excellently this way, you can never score anything less than 400. Speaking is the easiest to score over 400 in all the, okay, between writing and speaking. I think speaking is the easiest because for listening and reading, the mark is a close marking in the sense that if you get it, you get it. If you don't get it, these ones are more subjective to some extent, the writing and speaking. All right, that's fine. So let's try Olainka, do you think you want to try now? Or Olaika Arusi, who want to go first?
I can try.
All right, that's great. So let me project the. Okay, so you have this task. You have 2 minutes to go through it. Then I'll ask you to start. And your 2 minutes starts now. All right, please start.
Good afternoon.
Good afternoon.
Dr. Olayinka. I'm one of the doctor here in this hospital. Please, what would you like me to address you with this morning?
You can call me Tunde.
All right. Tunde, going through the case file with me here this morning, I would like to find out, I could see that you're complaining about chest pain that you had.
Yes.
Yes. So I would like to find out more about this chest pain.
Well, it's actually happened suddenly. When I was driving, I kind of suddenly started to feel this stabbing, like as if my chest was initially heavy, and all of a sudden started to burn, and the pain was so excruciating that it was going through my shoulder tips and blade. I'm really kind of worried, doctor. Please, doctor, I really don't want to die young.
I'm really sorry about what you're going through and how you're feeling about that. But it's Is it something that started suddenly, or you've had similar experience in the past? If I may ask about that.
Yeah, as I said earlier, it started suddenly while I was driving.
Okay. And any other things you experience aside from this chest pain?
No, not at all.
Okay. Um, I would like to reassure you that this particular chest pain you are having presently is we need to do thorough investigation in terms of just to find out if it's not associated with any other things. And also from your case file here, I saw that you have history of hypertension and diabetes. Do you know anything about that? Or are you aware about that as well?
Yes, I've actually been hypertensive and I've been having high blood pressure and high sugar levels for over 6 years now. And why I'm so afraid is because I actually lost my dad when he was 46 years.
I'm really sorry about the loss of your dad. But I would like to know, are you on any medication for these two conditions, that is the hypertension and the diabetes?
Yes, I've been taking my medications as prescribed. But doctor, do you think this is what I'm experiencing is a heart attack?
Well, from what you have given me and the past history of other condition you have, I can say that it's a kind of myocardial infarction. That is a heart problem that is a heart problem, which I refer to as a myocardial infarction. But in an attempt to further know or how to know about the condition, we need to do some investigation to further let us know how bad this condition is, if that is okay with you.
Okay. So when are we getting started?
All right. In that case, I will be transferred, you will be transferred to the hospital for an advanced investigation and treatment as well.
No, 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 no. I don't want to go to the hospital. I want the treatment to be here in this GP practice, please.
Well, I'm very sorry about that, Tunde, because there are some things that we are just limited with. This is the condition that require you being attended by a specialist, and a specialist we don't have in the clinic here. That is why we need to refer your case to where the specialist is. That's where the condition can be thoroughly looked into. And I believe if you see this specialist, it will give you
All
more
right,
insight.
your time is up. Okay, that's fine. Olaika, you've been on the exam hall now and you are out. How do you feel?
And, it's so funny.
All right, that's fine. If there's one thing I would say, at least you were able to sustain the whole thing till the end. Your flow is good and all. But let's hear from Tobe and see what he has to say. All right, Tobe, your hand is up.
Thank you very much, sir. I want to commend the last speaker. That was a very good attempt. But I'd just like to humbly just correct one or two things.
Yeah.
You kept saying, I'm so sorry. I'm so sorry. You did not kill the father of the man. You're not the one that made him to be hypertensive and diabetic. So you're sorry for what exactly? So I feel like you can say, oh, I can only imagine what you're passing through. And when he said, I lost my father 6 years ago, or I lost my father 6 months ago, that's quite a very big event. You should have paused there and say, oh,
Yes.
wow, how have you been coping?
Okay.
And how have you been bearing this loss? I can only imagine how difficult this must have been. I want to reassure you that in this clinic, we're going to do all we can to support you, okay? And you give some seconds. The person might, you know how I don't know if you're in the UK, but these people, they cry easily. You give some seconds. You might what if the person starts saying, starts sobbing? Are you going to quickly say, oh, we're going to transfer you? No. And here you don't command. You discuss and negotiate because people's lives, people are in control of their lives. So you can say things like, I will kindly advise that you be transferred to a bigger center where there are more equipment that can cater for these needs and we can investigate further. Is it something you're open to? And the person says, no, I want it in this clinic. You now say, I will further advise that even as much as I understand that you want to be treated here, these equipments are not here. And it will be in your best interest to go to a place where there are specialists who look after the heart. Then you said something about
Are you listening to
my
those keywords? Are you listening to those keywords? So it's patient centered. It's you are saying it's in your best interest. That's a very, very strong and will I say empathic keyword to like support your own incorporating yourself in patient perspective and your relationship with the patient. Go on, Toby.
yeah. So and you said something, I think it's my cardiac infarction. This is somebody who is not medical. How will he
Yeah.
understand what
And
my cardiac infarction means?
even at that point, the patient himself initially said heart attack. So I think it's just simple for you to still repeat that heart attack instead of telling him
Exactly.
myocardial infarction. And the irony of it is that even Olaika was the one that corrected what was the name?
No, you because you already said you had heart attack. Then I said you have
Yeah.
it's an heart condition. But at that point, I don't
Yeah,
know what else to say.
you
Since
repeat
you
that
already
heart
used heart
attack. You
attack,
don't no,
yes.
no, no. You repeat it. You repeat what the patient has said. You don't need to paraphrase anything. Yeah.
All right.
Yeah,
But
yeah,
but
yeah.
but overall, I think it's a very brilliant attempt, and I feel like if you just get more exposed to the speaking, I feel like you could actually do very
Yeah.
well. But that's a very very brilliant attempt. Thank you so much.
Thanks for
Yeah.
your contribution.
Yeah. I think Toby has actually said most of the things that I wanted to highlight, to be honest. The thing is, let me just highlight the great things that you did. Number one, I like the fact that you were calm and collected. Do you understand? It make you were in a relaxed mood the way it's supposed to be. Yeah, there is no, you are not showing any anxiety or any form of fear or unsettling, and you were in command of the situation. There was a time it appeared as if you almost lost it. You immediately reconnected yourself back, and that's how it should be in on that exam day. I also like the fact that you reflected back on what the patient has said, what is on the background note that you are this, you kind of check with the patient. Are you having the hypertension and diabetes from what is on your note? That is very brilliant. That's how you should do it. Do you get? So, but it cool that because if I were the one that played this case, this particular case, just as Toby mentioned, especially at that place, I wanted to solve, but I said no. But the way I expressed myself that my father died and I don't want to die young, at that very particular point in time, you should start bringing all those things. Do you understand? I can't imagine how difficult this must have been for you, and I can now understand why you are so much frightened and concerned about this pain based on the fact that your father died at the age of 46 and now that you are 45. But I can really assure you, you've come to the right place and we are going to do everything possible to make sure that this does not happen to you. So you try as much as possible to reassure, reconnect from what the patient has said, use what the patient has said to showcase your empathy back to that to the patient. Okay. And if even at that initial point, I personally will offer this patient a part of also showing my empathy and relationship. I personally can offer this patient some pain medication. Even when you mentioned investigation, which I kind of liked, at that point, I can see the least we can do, we can quickly just do an ECG just to quickly confirm, and then we'll now transfer you to the hospital, things like that. Do you get? So but overall, this is a very great start, a very beautiful start. And I believe with more practice, you start incorporating all these things. Now, at that initial point, to introduce yourself, and then you say, I'm one of the doctors in this hospital. Please try as much as possible to understand the setting, because the setting where you are is a GP practice and not the hospital. And at that initial point, I told you that the pain started suddenly because they also assess your listening. Are you listening actively?
All right.
Or you kind of re-ask me if the pain started suddenly, whereas I've already said that. So if I've already said that, you don't need to ask me. You can, if you're not sure if I've said that, you can say, I can, from what you said, this patient has suddenly that. Am I correct on that? So you're also trying to checkmate the information that you've also heard with the patient. Okay. But overall, this is a very fantastic, a very good one. I believe with more practices, definitely you will score anything. You guys will score anything less than 400. But overall, this is just how the speaking class or the speaking will be on that very day. And if you've mastered the art very well, you will really do great. Yeah. Okay. Any questions? No. Okay. Rosie. Rosie. Hello, Rosie.
Yes, yes, I can hear you. Sorry.
Are you able to play a role or your environment is
Okay, that's fine. You just have to sit.
okay? So I'm going to project your case and then the interlocutor case together, but please just focus on only your case, because on that day, on the exam day, you are not going to see the interlocutor's case on that exam day. I can even make it this way. In the next speaking, I'll get you more standardized task for the ball. This is your first one, so I want to use this one first for you. In the next speaking, I'll get you more standardized task. So this is where you have to focus on. Yeah? Rosie, are you there?
Yes.
So this is where you focus on. I will be the one focusing on this one now. Okay? All right. So I'll give you 2 minutes to go through it. Then I'll ask you to start. All right. Your time starts now.
Hi, good afternoon. My name is
Good
Rosemary.
afternoon.
I'm the pharmacist on duty today. How do you want me to address you?
You can call me Thompson.
Oh, okay. Hi, Thompson. How
Yes.
have you been?
Well, I think I just came to see if I can get my medications again. But to be
Mm-hmm.
honest, I really don't like taking these medications.
Oh, okay. So what medication is that? Is it on prescription?
Yes, well, I've actually been on amlodipine for my high blood pressure and metformin for my sugar levels.
Oh, okay. You just mentioned the point. You said you've not been taking it regularly. Why is that?
Hmm, it's really not easy taking these medications. And I just read from ChatGPT that this medication can actually damage my kidneys. So I'm a bit worried about taking them.
Oh, okay. I understand your concern, but you know that adherence is the key. I understand that you're scared of the long time associated effects like the kidney problems and all, but at the same time you need to adhere to sorry. at the same time, you just need to adhere on how you directed to take the medication, because if you don't, you keep having a high blood pressure, and
I say there, Rosemary. Hello? Hello?
sorry, I had to attend to my baby. So sorry,
Oh, no
so
problem.
sorry.
But are you comfortable now?
Yeah.
Okay,
So,
go
okay,
on.
you just need to adhere to your medication, because this will help your condition greatly. Also, you talked about um, okay, I'm lost.
Hello? Hello?
Yeah, I'm here. Sorry, trying to gather some points.
Okay. Okay. So let me just cut in now. Yeah. This is your first task to ever present. You don't really need to beat yourself so much. I believe with time you'll be good. But there are good things that you did that I'm really, really highly impressed about. You were able to, first of all, you asked me what medication that I'm taking, which you are trying to gather information from this patient, which is quite great. And that's the usual thing you are supposed to do. Now, the patient is kind of complaining of him reading deep ChatGPT and all, and concerned about this thing. And he said he has been missing his medication. In on a real life base, what's next after knowing the name of the medication this patient is taking? What other information as a pharmacist will you be asking this patient for?
How
Hello?
long he has been taking it?
Yes, I can want to find out how long has he been on this medication. Yes, these are the information that you guys will talk about. Yep. Which other thing?
Um, if he had any side effects, then from how long he has taken it, from there I will know if he had any side effect that warranted
Ve-
him to.
Very good. You can ask. Very good. These are things that you kind of try to find out. If any side effect has happened before that made him to start looking into ChatGPT to see why it's talking about kidneys now. Do you get? And again, he's taking the medication. How has he been taking that medication? What is the dose? He said metformin. What dose is he taking? What dose of metformin? How was it prescribed? So that you will even know how to help him to adhere to the medication. Is it prescribed twice daily and is not taking it once a day? Or is it doubling the dose now? Or quadrupling, was taking it just once instead of twice a day as prescribed?
I
Do you
was a bit
understand?
lost, because from like how I started, it's a repeat prescription. So it assumed that maybe the doses and everything is repeated, that I should have seen it. Do you understand? So that's why I
Yeah,
got this.
but yeah, you are trying to, it's not as if you don't know what the patient has been prescribed as a pharmacist, but we are trying to confirm from the patient to actually see if they're actually taking it the way it's prescribed.
Okay.
You get what I mean? Because you
Yeah.
will have all this information, but you checking that's what we usually do in the hospital. You check all those things just to be sure the patient is doing the right thing. You might be shocked. They ask the patient to be taking twice daily, and the patient has been taking it 5 times a day.
Yeah.
Do you get? So that's where you now correct all those things first. Because your first task say explore adherence. Do you get? You
Yeah.
have to find out all those. These are the questions you ask about all those adherence. Then before you now start addressing the concern, you read these things you say you've read this from ChatGPT. I'm really glad that you are so much particular about your health, and you are looking for information in different places to kind of help your to kind of help your health. This is a very good seeking health you have a good health-seeking behavior. But you see, there are reasons why this medication have been prescribed. And if you're not taking this medication, your high blood pressure and your sugar level may worsen, and the complication they may arise may even cause you these kidney injuries that you are worried about. Do you get? So these are the kind of things that you bring up again. Yep. We have less than 1 minute again for this session to end. And if it will end, we'll have another 10 minutes break. When we come back now, I will give you the real task now to do. Is that okay?
Okay, that's fine.
Yeah. Any question before we go on a break?